Okay, so I'm going to talk to you in the main about the blood pressure quality improvement toolkit, and I want to take you on a little journey of how this has come to be. But before I do that, what I wanted to do was just take you through what's happening with the BP projects across Cheshire and Merseyside, because quite independently, quite a super different initiatives have raised their head, and a lot of the thinking and the role I've been doing is how do we bring all of these different initiatives together. So firstly, there's the National BP at Home programme, and a lot of that has been around actually getting BP monitors and cuffs out to patients, and there's currently a huge drive around that. Within Cheshire and Mersey, there's also a digital first initiative with some pilot sites considering what platforms, what methods are best to use for a patient that is participating in home monitoring. How do they get the results back into practice? So there's several initiatives that are looking at that. There's key ones around AccuRx. There's the use of Flow, and also an app-based things with OnROM. So there's 3 pilots going on there. And as Matt mentioned earlier, there is the National Proactive Care at Home, which does sort of overlap with the BP at Home programme, and does also overlap with the blood pressure quality improvement toolkit, but a lot of resources are available through that as well. And then there's the Cheshire and Mersey initiative, which is the blood pressure quality improvement toolkit. And that's around supporting optimal management within the general practice setting. So just going back on the journey back to 2016-17, this was the overriding ambition of the hypertension board that we had locally, was that we want better ways to identify people at risk and help them avoid disease. And alongside of that, we also knew that we needed to support the reduction in heart attack, strokes and other conditions caused by hypertension by optimising management in primary care too. But we sat there and scratched our heads and thought, well, how do we begin to do that? And our first thought was, well, you know, let's just put on some training sessions within PLT, or look at how we can sort of get some more education out there. But what we decided in the end, and I can't emphasize the importance of this enough, we really took time to think and consider what the frontline actually needed and what some of the issues were. So CHAMPS, along with NICE, coordinated a series of workshops to understand better the issues on the front line. And we were told very sort of key things, really. Firstly, that there was very little data at the time currently available to understand how well a system or individual practice was doing. Certainly, you know, we could lay our hands on QOF data, but anything else around it was proving to be quite difficult. General practice again told us that there was reduced capacity to attend clinical updates and training, and so there was some concerns around CPD. There was a change in workforce even back then, that hypertension was becoming increasingly managed and monitored by practice nurses and health care assistants. And some, particularly more at the healthcare assistants end of things, they preferred a sort of a more structured support around that. At the time, it's less applicable now, but there was different targets between QOF and NICE, and also nursing staff highlighted that, you know, different clinicians tended to work to different targets as well at the time. We were also told that the nursing workforce like structure and protocols, and GPs less so in terms of filling in templates, but nurses like them. And also it's highlighted that there was limited patient and public understanding of blood pressure, and so we needed to address that too. So we came up with a solution of the blood pressure quality improvement toolkit. Firstly, we developed a dashboard, and I'm going to demonstrate to you how that works. But that supports the proactive care framework in terms of prioritisation criteria, but it also helps the practice understand how they're doing against nice quality standards. So it really helps to understand if you've got any challenges or issues in terms of the care that you're delivering. We've also got the a consultation template, and this is mainly sort of focused on nurse practitioners, clinical pharmacists and the healthcare assistants too. So alongside it being a good quality consultation template, it does act as a bit of a walkthrough guide. So it will tell you when you need to escalate something up. It will sort of give you reminders as to, we'll consider this situation. And it's also got inbuilt support tools. So for example, if you've got kidney disease, your blood pressure target might be slightly lower, and that's all inbuilt within EMIS that you can just reference within the consultation. So it's a bit of guided support alongside making sure that you're using the right codes and everything's recorded the way that it should be. There is a practice protocol as well. So if there's an area of work that you think, oh, I always need to prompt myself on this, there's handy inbuilt sort of flow charts that are in there that you could have at the side of your screen if you should need to, or on your desk. And then there's a patient information leaflet that can be printed off directly from EMIS, and you can include within that from the template currently what the patient's current blood pressure is and what the target should be. And you can also add in a link to any local initiatives or local health and wellbeing trainers, etc., for the patient to make contact if they should want to. So moving swiftly on, what we wanted to do, we thought that was the right answer, but we wasn't 100% sure, so we tested it out. And we engaged 10 practices across the Cheshire and Mersey region. And we did do a very sort of short and sharp pilot over a period of 3 months. Sorry, excuse me. What that did do was demonstrate very quickly to us that we saw an increase in the improvements against nice quality standards. Sorry, excuse me. So we saw that improvement of control very, very quickly. We saw the patient receive the full investigative range very, very quickly. And we also conducted an independent qualitative evaluation. And this showed that actually it went down very well, that GPs and practice nurses really quite liked it, that, you know, we've got comments such as it was a fantastic tool. The practice nurse really felt that it helped patients take ownership of the blood pressure, and the healthcare assistant felt more supported as well. What it also did as well was highlight that there was certainly key themes and key questions that were coming out from using the tool in terms of both clinical knowledge and also the process within general practices as to how certain things were recorded. So for example, a lot of practices were using recalls based on medication rather than being set from clinical need perspective. So there was opportunities that appropriate reviews could drop off rather than sort of taking a consistent needs-based approach to BP ongoing reviews. So I'm just going to quickly now take you through the dashboard and what it can do. So clearly here we've got the kind of information that you would generally expect to see. So we've got practice population, we've got numbers on the hypertension register, numbers of observe the expected prevalence. But this is where BPQI links in with the proactive frameworks. So you can see here we've got the 4 priority groups. What it can do is that we can look here, and this is the straightforward proactive risk stratification. So we can look at, say, let's go for priority 2A. We can hit filter and it will take us directly to those patients. We can see as much information or as little information as we want to around that. So we can see what the latest blood pressure was and the date of that. We can see the BMI, the Q risk, what the cholesterol is, what the EGFR is. We can also look to see significant medication that they're on. We can also look to see what comorbidities they have and how they align against NICE quality standards. Sorry, excuse me. So just going back to the dashboard again, I think one of the most important and useful bits that is in excess of just straightforward searches is that we can also look at how the quality of what we're doing is faring. So if we are moving to a more remote way of monitoring, we can also see if the quality of care is going up or down, and we can see if a certain area, such as within this particular practice, lifestyle was dropping off, that we need to begin to address. So you can monitor and see whether things are improving or less so, or if you've got any areas of concern that you perhaps might need to pick up as a practice. And you can filter using the same measurement that I showed to you before, just to see who those patients are against any one of these indicators here. You can also begin to see, using the National BP at Home pilot that I mentioned before, that you can see how many of your patients are beginning to use remote monitoring as a method of choice. So, that this dashboard was run back in February, so there wouldn't have been many patients on there, but over time, hopefully you could begin to see that the number of patients that are moving towards more of a remote monitoring way of doing things increase over time. So it'll pick up both ways of doing that. And you can also filter by Q risk should you want to. So that's in terms of someone's CVD risk. And if a practice is looking to reset following a pandemic, it probably does make more sense to look at the proactive measures and go solely by blood pressures and other social factors, but you might want to, in the longer term, look at someone's Q risk and consider your priorities around that. It does also help with coding, so you can see here straight away who are your patients that have got a high blood pressure reading, but they're not necessarily on the hypertension register, so you can take a look at that. There's a lot of ways that a practice can choose to use this, and it's very much a sort of individual practice choice as to how best you want to go forward. But certainly, in the first sort of tranche, probably proactive searches are the way to go. So I'm just coming to the end now, but just quickly to summarize, so some of the challenges that we've got is that there's pockets of really good engaged practice, and then there's areas and practices that are less so. So we have developed some key messages that we're working systematically to get out there. Certainly for us, and using the BPQI, that it's aligned to both Proactive at Home and the National BP at Home programme. The BPQI tool does make it easy to achieve national ambitions. It does has been demonstrated to improve outcomes, and it's been built from the ground up based on the insight in those early workshops where we were told very clearly what the issues were at ground level. it's well accepted and liked, and it's free. We are also developing sort of toolkits, working alongside a lot of the work that's been developed by the BP at Home programme and Proactive Care at Home, as sort of an onboarding pack for practices, so that when they come on board, that they're thinking every step of the way of what they need to do across all the initiatives that we have going locally, alongside sort of patient information. And if they're moving to the remote monitoring, what does the patient need to know, and how can we skill up that person, either from a digital perspective or from a non-digital, but both carry equal value. We've also thought about resources, and we have updated our Happy Hearts website to enable both from a patient perspective and also for professional resources there. We run Facebook campaigns encouraging patients to understand what their blood pressure is and do they know, and how to make contact. And we've developed various animations for using vaccination centres and the general practice setting.